you came on board in 2017 along with Governor Cooper.
That's right.
Yeah, and so what's going on? What is next from this point? So Friday you'll be leaving your position.
Friday I'll be transitioning out of this position. When I joined the Cooper administration almost 8 years ago, really was committed to staying through that administration, giving stability, really wanting to bring to life all the priorities of the governor and the secretary, and have now been very committed in making a smooth transition to the new administration. So very supportive of the new governor, Governor Stein, the new secretary, Secretary Sangbai, but now I'm going to transition out to take a little rest, a little breather, and then think about what's next.
Yeah, and you have so many opportunities because this is such a vast, I mean, your role in this, what if you had to sum it all up the last 8 years? I mean, pandemic, there's been so many different things, but it's just a huge leadership position, and I'm sure a huge learning opportunity too for you and what you do.
It is, and I would say first and foremost, it's an incredible privilege and honor to really have the ability to serve the people in North Carolina in so many different ways. So a huge learning opportunity, very challenging at some time, very busy, but always felt that it was a great honor and privilege to be in the seat, to be able to really make decisions and put into place programs that could help people of the state.
What are some of your greatest accomplishments in that time? I know that there were a lot of priorities, and then COVID kind of reprioritized. But looking back, what are you the most proud of?
I think the three main things I really leaned into in a proactive way is one, thinking about whole person health, making sure that we were helping improve the health and well-being of people, and that means meeting all of those factors that influence health. So access to high quality medical care, critically important, foundationally important. That's why Medicaid expansion was so important. Almost 620,000 people now have access to health insurance and high quality clinical care. But for a lot of people, that in itself is not sufficient. And you have to think about all those other factors that influence health, like do people have food? Do they have housing? Are they safe? So that's the premise of what we call our Healthy Opportunities program, making sure that we're linking medical care and social services so we can meet all those needs of the people. And we've had great success in that. The other place I really leaned in on is thinking about reproductive health and access to contraception. 50% of pregnancies are unintended. That can increase the risk for moms and babies. So we want to be sure that people have increased access to contraception so they can make informed decisions for themselves on their reproductive health. And then finally thinking about violence, and particularly gun violence, as a public health as well as a public safety issue. I'm thinking about how do we bring together people to have the conversation on what can be a contentious issue, find those areas of consensus and move forward. So those three areas I think I'm really proud of that we've been leaning proactively. And then of course reacting to COVID, and then our natural disasters, which we've had multiple, but of course Helene being the most recent and really one of the most devastating ones that we needed to react to.
From a public health standpoint with Helene, what are some of the things people may find surprising to learn or know? I know we focus on just the initial, devastation, and there's the housing issue, but there are natural progressions in public health after these sort of things. So I guess that's an interesting point. A lot of people are focusing now too on California, which is bringing back up talk about Western North Carolina. What would people be surprised, or maybe what should they know following something of that magnitude?
A lot of people don't know the role of DHHS in disaster response. They think emergency management, they think public safety, and of course they play a critical role rescuing people, logistics, infrastructure. But when you think about it, we handle the health and human services part of the response. So some things immediately, we want to make sure that our acute care hospitals are up and running. So people are having life-threatening illnesses or injuries, they can get that life-saving care. We need to think about making sure our community pharmacy and medical providers are up and running so people can get their prescriptions, they can get their health care needs met in the community setting. So that means supporting our providers or mobilizing mobile units. We need to think about people's behavioral health needs. When people go through the trauma of this disaster, their behavioral health needs are huge. So how do we respond to those behavioral health needs? And then how do we make sure people have the information they need to prevent injury and illness? So for out west, we had to talk about people testing their well water and how can their well water be clean, understanding all the communicable diseases and the risks to health in the wake of a hurricane, and then working with our restaurants and our schools and our childcare. How can they reopen safely, making sure those health needs are met in those settings? So those are some of the health pieces that we responded to. And on the human services side, making sure people's basic needs are met. Shelter, we do a lot of work in sheltering. Food, water, formula, diapers, making sure people's basic needs are met as well. So some of those we do in the immediate response to the hurricane, and then ongoing as part of that recovery, we address those as well.
Yeah, it's funny. I don't think people think immediately of NCDHHS when you
That's
have a
right.
natural disaster response, but that is a huge part of what you all do.
That's right.
Yeah. So in doing what you do, I think we really got to know you very well during COVID, and I know we have a lot of clips to show and just kind of how things evolved. What were the biggest things you learned? You know, that was unprecedented, and going through all of that, what are some of the biggest things you learned, or the biggest takeaways from dealing with something of that magnitude?
Yeah, and it was.
I know it's a very broad question.
Yeah, no, it is, and it was a really challenging time for the world, as well as the country and the state and our communities. It was really challenging, and I think the tale of that is going to continue for many years. I think as I think about our response, three main take-homes that I have in my head is one of the things that made it so challenging is it was new. This was a new virus. We didn't have the information we needed, and it was continuing to evolve and change. And so that is hard. That is hard to try to make decisions with information you know is limited, and then continue to have to reassess what you know, the changing environments, and continue to change your response. And what we tried to do was be really transparent and our proactive communication with people to say, with what we know today, this is the best decision today, but that we promise as we learn more, as things change, we'll continue to change our response. So that was a challenging part of it, but we really tried to lean into that in the transparency that we knew we would be changing. Second is the critical nature of partnerships. DHHS and the state can never do anything on its own. Really wanted to lean into our federal, our state, and our local partnerships, and making sure we had those trusted messengers on the ground and those really, really close partnerships. That infrastructure that was set up in COVID has helped with some of our other major initiatives, like Medicaid expansion. We really leaned in with those community partners to really help get the word out with Medicaid expansion, which is one of the reasons I think has been so successful. And then third, making sure that we're meeting the needs of all of our North Carolinians. So using data to figure out who's at most risk for COVID, who's most risk of getting exposed, and then making sure we're deploying our testing, our treatment, our vaccines, our guidance, so that everybody has access to those health protective measures. And so I'm really proud that our vaccination rate in our 65 and older people who are at the highest risk of severe disease, illness, and death, very, very high rates in North Carolina compared to the nation, and really no disparity between our African Americans, our white, and our Latino populations as well. So I'm really proud of that. We brought those life protective measures to all North Carolinians.
And I'm sure, like you said, it was instrumental kind of in the pipeline of learning and then conquering some of the other big priorities as well. The Medicaid expansion, that was a huge one. That had been going on for years too.
About 10 years.
Yes.
10 years. This is I can't speak more highly of Governor Cooper. Now, I'm very, very supportive of Governor Stein as well, not taking anything away from him, but Governor Cooper is an amazing leader, and this is one of his highest priority, and his perseverance in his 8 years of governor to get this through is just a rousing success of his leadership.
Yeah, it's probably one of your biggest, your proudest accomplishments too during your time.
Yes.
Yeah. What are the biggest challenges for our state, going forward as you pass the baton and you're briefing and transitioning? What do you think the biggest issues are? I mean, we know Stein really leaned in heavily to tackling the opioid issue, and now we're dealing with, his focus is highly on Western North Carolina. He talked about in his inauguration speech. But from your perspective and with all the data and your boots on the ground in many cases, what do you think the biggest challenges are going forward?
I think there's several. I think one, and I think Governor Stein's priorities are great. I think with our climate change, we're going to see more severe storms, more frequent storms. We're going to really have to think about the impact of climate change on our economy, on our health, on our infrastructure. So really leaning into that preparedness and thinking through how do we support our communities is going to be a really important issue going forward. Second, behavioral health. all aspects of behavioral health it's been something we've really leaned in this administration and will need to continue as well. That includes opioids and substance use disorder, as well as other parts of behavioral health that we'll need to continue to lean on. The third piece is we really need to think about our young families and our young children. I worry about, one, our child care cliff, and making sure that our early childhood and child education is firmed up. Early childhood education is critical from three pieces. One, it's the workforce behind the workforce. If we want healthcare workers or other workers to be able to go to work, they need a place, a safe place to save their children. So that's a workforce behind the workforce. Second, high quality child care is actually a really important health intervention. That 0 to 3 years in that infant brain, that is the most critical time of brain development. So having children in a high quality nurturing environment is a critical health intervention. And three, it also protects children from harm. If parents don't have a safe place to leave their children, then they can be left in unsafe places, and then we worry about abuse and neglect in those settings. So early childhood education is a critical piece going forward. And thinking about our child welfare system as well. It's pretty fragile in our state. We have 100 local DSSs, and so I really worry about the support for our young families and our child welfare system. So those are some things that are on my radar, and I've been counseling our incoming administration to think about.
Yeah, we wanted to talk about the Office of Violence Prevention, and you know, we when you talk about youth, I know we're talking about very, very young, but gun violence in young folks is a huge problem across the nation. How does that factor in as well? It's a tough one.
Yeah, and it's been a tough conversation for our country to talk about violence, in particular gun violence. And what we really were finding was anytime anybody talked about firearms or guns, people just went to their corners. And there wasn't really an ability to have any sort of conversation about this really important public safety and public health issue. So we really thought about, how do we bring this public health lens to this critical issue as a way to have bridges across people and really to think about how do we have the conversations. And so by thinking about, you know, using our data to figure out where really is the problem, bringing people together to say, where are there areas of consensus? And there is a lot of consensus. Everybody wants the same thing. They want themselves to be safe, their loved ones, their families, their communities to be safe. So by bringing people together and finding those points of consensus was really helpful. And we had a roundtable of law enforcement and public health and healthcare together. And then thinking about, what are those programs, those initiatives that there's evidence that it works, and there's consensus around that we can work together on. So that has led us to, one, establish the Office of Violence Prevention, again, that thinks about this from a public health and public safety standpoint. And then some of our initiatives we worked on is safe storage. A lot of agreement that if someone has a firearm, they have that responsibility to keep it safely stored. So we're doing a lot of work around safe storage. Also work on funding our hospitals and our communities for violence interruption programs. So people who are victims of violence, wrapping around the support around that individual so they're not going back into a violent situation. Thinking about suicide prevention. And actually, more people die for firearms from suicide than homicide. So let's think about suicide prevention. This is where safe storage comes in really critically, because adolescents, if they were to commit suicide with firearms, they typically get it from home. So thinking about safe storage to especially prevent our adolescent suicide. Thinking about our people that are leaving in carceral situations and reentry. Really high risk thinking about violence. So how do we wrap around that support so their reentry back in society, they have a different trajectory than that which got them into a carceral situation in the first place. And then finally thinking about our people living in a domestic violence situation. If there's a firearm in the home, in a domestic violence situation, there's a 500% increased chance of homicide. So let's think through, how do we work on lowering firearms in the setting of a domestic violence situation. So those are the areas that we've been leaning into. There's broad consensus on those. It's very high-risk populations, and we've been able to have the conversation and really make progress in some of those areas.
Do you feel with COVID, I know it was like minute by minute, and I don't know what it was like pre-COVID, but I feel like the communication between the state and local agencies may have gotten a lot better with lessons learned through COVID. Do you feel like the partnerships got stronger with some of the lessons that were learned during COVID and just how fast everyone had to respond? Do you feel like from the state down to the local level, it maybe strengthened some of those communication lines
I do.
and outreach too.
Yeah, I think we always have had strong communications with our governmental agencies. So from state Department of Social Services and our local DSSs, from our state Division of Public Health and our local health departments. So in our state and government agencies, we've always had strong communication. But where we really expanded, and I think this was critical, was to our non-governmental community-based organizations, to our faith communities, to our other social service agencies that aren't governmental, and brought them into the fold and really partnered. It was this public-private partnership, and with our non-governmental or community-based organizations, that's where I think the partnerships really flourished, and that we've really been able to continue and leverage that. So yes, I think and that was intentional, this intentional partnering with our communities during COVID.
Yeah, we have to talk about reproductive rights. It's a hot button issue for a lot of folks. What are your thoughts just on where North Carolina stands and the argument of this, where we are as a state and going forward?
Yeah, and again, I think even though this can be a controversial topic, there is absolutely areas consensus. And I think in general there's consensus that if people are informed with information and resourced, that people making decisions about their own health care and their own reproductive health care, that people are better off when they can make those decisions, and that when pregnancies are intended, that helps the person being empowered to make the decision of when it's the right time for them to have a child, and also we have better outcomes as well for the mom and for the baby. So that's been an area we've really leaned in on. This is like, let's make sure we're increasing knowledge about contraception, about family planning, increasing resources and access, so again people can make informed decisions for themselves when is the right time for them to be pregnant or not. So we've done a lot of work, especially partnering with our pharmacists to expand contraceptive access in our pharmacies. Not only now can our pharmacists prescribe contraceptive on their own, and more than 350 pharmacies across the state have pharmacists who can prescribe contraception, but also we cover the over-the-counter contraception, O-pill, as well with Medicaid as well. So partnering with our pharmacies to get access to contraception has been really critical, especially in North Carolina in our rural areas where there sometimes is fewer healthcare providers, but there are pharmacies. So a really important point of access for our rural areas.
Yeah. So what's next for you? What are you looking forward to? I mean, you've done a lot.
Yeah, and again, when I joined this administration, I was very committed to staying and running through the tape of this administration, and then again committed to making a smooth transition for the next administration. But now it's going to be a little time for me to take a breather. I have some older parents, want to spend time with my parents, with my children, with my family, so little time to take a breather, re-nourish my public servant soul, and then think about what's next. I don't think I'm going to stray far from public service. It is what feeds me, but just taking a little bit of a break and then figuring out what's next.
Will you stay in North Carolina?
I intend to stay in North Carolina, yeah.
Where's home for you?
Well, I grew up in Massachusetts, but then I was in Baltimore for 7 years, but I've been in North Carolina since 1996, so I've lived in North Carolina the longest.
Yeah, it feels
anywhere.
like home, yeah.
Yes.
Anything else you want people to know, just before you sign off?
I think that one of the things we've really tried to bring to life in this administration is really centering our work around the person and around the whole person. So thinking about what do people need to thrive, and that is health care, that is also health, that is human services, it is safe communities, and so that I think is just a legacy that we've had is focusing on the person, that whole family. I mean, I hope people have seen that and embraced that, and I think that's an area, again, of consensus. We all want our people and our family to flourish, so when we focus on the person, that can bring a lot of people to the table and open up conversations better than other ways.
Awesome. Thank you so much.